Oh, God!
There we go.
Don't worry, it's okay.
Let go of me. Let go.
We're back on shift inside the ambulance.
Whoa, got a job.
Do you need me to get in the back? You might have to stop.
With more medical emergencies
I'm okay. Ooh, that's a good one.
and more cameras,
What's that up there?
That, Tyler, is a little camera.
we're taking you back to the heart of the action.
Just lie down for me. We're from the ambulance, OK?
I'm sorry.
I don't want to go so off, please.
There are some new faces
I'm happy to be your crewmate.
I feel like we've bonded.
and some old friends.
I'm better driving than you.
Is it the fact that I'm faster and smoother than you?
Your driving's terrible.
How can I help?
Body-mounted cameras record every moment
Nice deep breaths. Come on, open up. Smash in.
to show you what goes on behind closed doors.
We'll get you right, all right?
You'll be on the front line with the ambulance crews from West Midlands Ambulance Service
I don't need to be a doctor. I just need to know what I can do to help.
as they deal with 3,000 emergency calls each day.
We see so many people who get told that nasty C word. So many people can fight it now.
Step inside the ambulance.
You take care, mate.
All right, mate.
Thank you.
I've just had a conversation with Kevin upstairs about our summer uniforms. I think we should have culottes. Mankinis for the boys and culottes for the girls. Imagine phoning 999 and a paramedic turns up in a mankini. Would you be able to take them seriously?
We're going to cycle, do another massive bike ride and end up with massive saddle soreness.
Mate, I've got like padded lycras, some sexy clothing. Feels like I'm wearing nothing at all.
You're 30, aren't you?
28.
I was going to say, because you're a middle-aged man in lycra.
not quite.
My daughter asked me if I was in the World War II. Yeah. She goes, Mum, were you in the World War II? I was like, not really.
Well, you are in your 50s, you're doing well.
All right, I know.
It's just gone 4:30 on a sunny Sunday afternoon. Paramedic Preet Lally and technician Liam Dale are just half an hour into their shift when an urgent call comes in.
It's Wolverhampton.
She's got back pain.
Cool.
As more information comes through, Preet starts to recognise some of the details.
I have been to this lady loads of times.
Grand. Best buddies then.
She has degenerative spine disease, and it's getting to a point where the pain in her spine is just, she gets random attacks. Absolute pain to cannulate. I go for a feet every time. Hello.
Oh, I know who this is.
Louise is just 42 years old, but has a degenerative spine condition that gives her spasms of excruciating pain.
How are we doing, Lou? Come here. Lou? Come here, darling. Let me grab your hand. What's the last thing you can remember, sweet?
When I fell, I was on the floor. That's the last I know.
All right.
And I've been back pain ever since.
Louise's son Jordan heard her fall and came down to find her on the kitchen floor.
Try sit you up first and then go from there,
Have you hit your head at all?
I don't think so.
No? No neck pain?
No.
There. Let's try and get you up, darling.
This poor woman has a degenerative spinal disease, so her spine is crumbling and there's nothing she can do about it. There's no treatment. All they can do is really treat the pain. Every so often, Louise can go into spinal spasms, which is Very painful, very sharp, and there's nothing she can do when she goes into one of these episodes.
It's okay.
All right.
Right. It's starting.
And it's starting again.
And then it slows down.
Yeah.
And then like, it comes with a big...
Yeah. I remember. You're okay.
You're doing really well.
They need to help Louise with her pain, but she's already on a lot of medication.
Have you had any of your morphine today?
Yeah.
When's the last time you had any?
Okay. Grab my hand.
So all are okay?
Okay. Obs are good, yeah.
Right, darling, you need to stay nice and still as you can. Jordan, it's Jordan, isn't it? Can you just hold her leg so that she doesn't move too much, all right?
Preet gives Louise liquid paracetamol, while Liam gives her gas and air, all to bring down her pain.
I don't want to go to hospital, please.
Lou?
What are you doing?
Louise, listen, because of your condition, I don't want to risk it, darling. I really don't.
They need to completely immobilise Louise to get her safely to hospital.
Right, what I want you to do is lay onto your back now, sweetheart.
But it's a painful process.
Well,
Really good, really good, really good.
well done.
Jordan comes with his mum to hospital. It's becoming a frequent part of his life. It's just 3 days since he last called an ambulance for her.
I don't want to go to hospital, please.
I know, darling, I know you don't want to go. But honest to God, with your spine background, I can't take that risk, sweetheart.
You're in more chest pain with it now, Mum.
Oh, God.
Keep going with that gas and air.
Oh, God. My back's cracking. I've got three, my back's cracking, I swear, I can feel it.
Whereabouts? Middle, the lower?
It's in the middle.
And again. I'm ready when you are, mate.
Okay.
Thank you, sweet. Come on, darling. All right, darling. Come on, sweet. You're all right. In.
Suddenly, at a green light, a car pulls out right in front of the ambulance.
You okay?
Yeah, some car just pulled out on her.
Are you okay?
You are.
I'm all right.
You okay?
You okay? Yeah. Good. Back on the gas.
Luckily, they're only 2 minutes from the hospital.
You okay?
Yeah, good.
Good.
Mate, I've really hurt my side.
Okay. Sorry, car completely pulled
Oh,
out on
no.
us.
It really hurts.
Okay.
Really hurts. Right here, I can't breathe in.
I'll take the top because it's a heavy bit compared to the bottom.
Preet will be examined in A&E to make sure she's okay too.
I just want you to be okay. Oh, I want you both to be okay.
No.
Back in the day, we used to have the midwives that used to come out. We have a community midwife. This woman had moved house and hadn't updated her address. So they rang to say that she was in labour. So the midwives, bless them, they'd gone to the wrong address. So in the meantime, we got called, we turned up. This woman's on the bathroom floor in full labour. Very messy job, as they are. Thankfully, she had a tiled floor. So we delivered the baby. We obviously cut the cord, we cared for the baby. We dressed the baby. We cleaned up and made a cup of tea before the midwives turned up.
No way. It's mad, that is.
I think that's an interesting thing.
This one piece will make 52 layers.
Watch on mobile devices or the big screen. All for free. No subscription required. Download Veely now.
It's Monday lunchtime.
Didn't like that.
Camera says no.
Hannah Meredith and Aaron Campbell are 4 hours into their 12-hour shift.
Updated assignment.
It's not long before they're assigned their next job.
999 mode activated.
We've got a 2-year-old fitting within the last 12 hours, suffers from convulsions, sudden seizure during his sleep lasting 15 minutes. Call from 111.
5 minutes later, Hannah and Aaron arrive at the toddler's house.
Hello there. What's your name, sweetheart?
Stacey.
You're Stacey. I'm Hannah and this is Aaron.
Oh, Stacey, right.
What's going on?
Anyway, princess, I think he's had a seizure. His temperature's 39.1. But he's not. He's not.
Alfie.
His breathing doesn't seem like it should be.
2-year-old Alfie has a history of seizures. He had his first fit at just 9 months old, and today's was so bad, his mum called for help.
But this is what he does when he's had a seizure. He'll go to sleep.
Why does he have them? Is he epileptic or?
No, they've never diagnosed him with nothing.
Does he always have a temperature when he has them?
After he's had a fit.
Okay.
Whilst Hannah checks Alfie's vitals, Aaron gathers more information from his worried mum.
I don't normally phone an ambulance, it's just I'm on my own.
Phoned 111, haven't you?
Say again.
Phoned 111,
yeah,
haven't you?
that's what I've done. It's his breathing, I didn't like his breathing.
Alfie is fast asleep, but it's important Hannah monitors his pulse and heart rate. She also needs to check his blood sugar levels, which means having to prick his finger.
I'm sorry.
Oh, he's welcome now.
Oh, that's done it.
Hello.
Hello, little man.
Hey, look, Donkey Kong. I'm okay. Look.
Nasty woman.
Oh, little boy. Come on.
Can I have your phone, buddy?
It's okay. Soon woke up then, don't you?
How long did this seizure last?
I don't know, because he was upstairs. So, look, my nephew's in the bedroom playing on his Xbox and he's heard him.
Yeah.
So he's got into him and brought him down to me. So as he's come down, I've got him Calpol, lied him down. And then he's breathing. And he's like, Harry was breathing and he wasn't waking up to us.
Yeah.
Okay.
For the last few days, Alfie has had a nasty cough and conjunctivitis. Stacey has given her little boy liquid paracetamol to try and reduce his fever.
I'm just worrying about your kid.
That's about quarter to 2 you gave him the Calpol?
Yeah.
Ish.
The liquid paracetamol is now starting to work, and it's not long before Alfie is back to his normal cheeky self.
Stick his finger up, look. Yeah, he's okay now.
Is that who's taught you to do that?
Oh, no, see.
But seizures still need investigating, so Alfie will need to go to hospital.
Going for a inside him, Anilo. Yeah.
Alfie's history of seizures is significant because we didn't have a diagnosis of epilepsy. However, that doesn't rule it out. It just means he might not have been diagnosed. So for us, it's what is the root cause of the seizure. The tests that we do are sort of non-conclusive in that respect, so it's important that he goes to hospital, really, to have a full checkup.
Oh, you're gonna be nice and cold.
Alfie needs to be strapped in for the 2-mile journey to hospital.
Never screaming, baby, in a minute. Oh,
no. Here you go, buddy.
However, he's not keen on going anywhere.
Come on, drink your juice. I'm okay. Hold me down, love. Keep bringing me like this. I'll make you cooler now.
Hopefully. How many fits has he had then?
Well, the first one he had, he died.
How
My
did
mum
that?
and his dad had to give him mouth to mouth.
Right.
That was from when he was 9 months old.
Right. When did he have his last bit?
February.
11 minutes after they set off, they arrive at hospital. Alfie will be seen by specialists, and hopefully his mum will find out why he's been having all these seizures.
Seemed quite all right, really, when we got there, didn't he? Once he woke up.
Yep, especially when I stabbed him.
Yeah, that woke him up.
That worked.
It's always a good one.
Yep.
We go out to quite a lot of overdoses, don't we? I think some of it is recreational. Sometimes it's accidental. They don't realise the dose that they should have taken.
There was a while when there was it was when I was a tech, when there was a really bad batch of heroin going around that was just sending everybody over. And I must have gone to about 10 in a week and a half, something like that. Yeah.
But we can only go on what the patient tells us and what's in front of us. We always have to err on the side of caution, really, with overdose.
It's just gone 9 in the morning, and paramedic Matt Rodwell and technician Liam Dale are on their first ever shift together.
We are off to a 45-year-old male from 111 who's put buprenorphine into an artery, now has pain.
Buprenorphine is a drug used to treat heroin addiction. It's normally given in tablet form and is not to be injected.
Just in the corner here, look. This one here.
Do me a favour, mate. Please make sure you lock this.
Oh, yeah.
Make sure you lock this.
Don't worry about it. Don't get locked in.
Are you the one that's called, mate? Cracking. Shall we just get you one? What's your name, my friend? Ashley. All right, Ash. Bear me 2 minutes. We'll just get the ram down, mate, and we'll pop you onto the bed. Pop yourself onto bed, dude.
Yeah, mate. Okay. You all right, buddy?
No, Mum. Stupid fault my arm.
You all right, mate?
I dug a buprenorphine. It hit my artery about 2 days ago.
Injecting into an artery raises the risk of a blood clot developing. When they form, blood flow is significantly decreased, which can cause major damage, even leading to organ failure.
I missed the start of that. So 2 days ago, you had some buprenorphine.
Yeah.
Okay.
Instead of taking it the way I'm supposed to take it normally.
So how are you supposed to take it?
Wanted me to
Okay, and what did you do with it?
put it in a needle.
Okay, and why did you do that?
Because my leg was hurting me and it was the easiest, quickest way to get rid of pain.
Heroin users, if they're going to develop a problem after injecting themselves, it's normally a blood clot. Blood clots can prove fatal depending on where they go. If it goes to a particular area of your brain, that will kill you, it will stop you from breathing. In terms of your lungs, it can cause damage to a particular section of your lung, or it can stop blood returning back to the heart.
Years of heroin abuse have destroyed Ashley's veins, and this time he's injected an artery by mistake.
Okay, and what vessel did you put it into? Into your groin?
Yeah, but I hit the artery because I'm out of practice.
Okay. And how long have you been a heroin user for, actually?
20 years.
About 20 years.
The symptoms of a blood clot are stabbing chest pain, shortness of breath, and agonising coughing.
So, whereabouts is the pain at the moment?
On my side, my shoulder, my side.
Okay. The pain you've got at the moment is all in your left arm, your left shoulder, and is it the left side of your chest?
Yeah.
Okay, left side of your tummy?
Not just my chest.
And what does the pain feel like?
Stabbing, but when I try to breathe, it hurts even breathing more.
Initially, I thought Ash looked really poorly. He's a very poor colour. He's quite grey. He's very uncomfortable. He's quite agitated, very anxious. Ash knew that he'd made a big mistake.
Matt examines Ashley, who's now worryingly showing all the symptoms of having a serious blood clot.
Lean forwards for me. Is that going to be uncomfortable? Sorry.
Yeah, but I don't bloody care.
All right.
Matt listens to Ashley's breathing and discovers something unusual.
Mate, have you ever heard the term pneumothorax before?
No.
I'm just going to tap on your back. Just relax.
A pneumothorax, also known as a collapsed lung, is when air escapes or leaks from the lung through the chest wall. This could have been caused by a blood clot.
Oh, what have I done now?
Matt is listening for a hollow sound, as this could also suggest Ashley has a collapsed lung. Another sign he's dramatically unwell.
Sorry, mate. Lean back for me, mate. Just relax, just relax, just relax. Pop this arm down.
What have I done now?
Just relax. Ash, just relax, mate. Just relax. You've not been in no car accidents or fights or anything like that?
Not at all.
Breathe in, mate.
Matt's found another reason why Ashley may be feeling so unwell.
He's got a massive pleural rub all over on the left-hand side.
What's that?
A pleural rub is the sound of friction caused by a serious chest infection. Because all Ashley's pain is on the left-hand side, Matt also wants to check his heart.
Sorry, I'm kind of hairy, so...
Mate, you got nothing to say sorry for. I'm exactly the same.
I think I'm a cross between Grizzly Adams and a gorilla.
I'm not quite sure what the problem is. You're going to need to have it seen to. I'm fairly sure it's not your heart. I appreciate it is the left-hand side. It's either going to be something to do with your breathing, okay, or it might be a clot, or like something what's called a pneumothorax. But regardless, it's going to need seeing in hospital. My concern is what you've done is obviously where you've put this into your artery instead of a vein. Okay, you've caused a clot. And if you've caused a clot, it's going to need to be seen.
If Ashley does have a blood clot, he needs urgent treatment to stop it travelling to his heart or brain.
Are you happy to come with me to the hospital, Ash?
Yeah, I've got to. Sorry about it.
No, mate, what are you sorry for? You can't help it. It's one of those things. Unfortunately, like oral medication isn't designed to go IV. It can cause you some real damage. When was the last time you used heroin, Ash?
Last time. About 12 weeks.
Okay. Alcohol?
No, I ain't drunk for 10 years.
Okay, alright, fair enough.
On the way to hospital, Matt gives Ashley paracetamol as pain relief.
Don't worry about the wires, I can always put it back. Steady.
Ashley will now be handed over to the A&E doctors for further assessment.
Can this fit in here?
Probably. I've got nothing precious.
It's just gone midday, and paramedic Tina Spittle and technician Donna Parcell have just had a Category 1 job come in.
We are going to a 52-year-old female with chest pain.
Okie doke. Well, we had a proper poorly patient yesterday, and I could have taken him home. He was a Burma Star War veteran, 91 years old.
I went to a 95-year-old the other day that was a bomber on the Lancaster bombers.
Wow.
He got all scarring down his arm because I crashed. He survived.
Oh, my goodness.
His crew survived, but then went back up and he died because of his injury, and they all never come back again.
Oh, gosh.
I could have sat there all day.
Yeah, that's it. I was like, I could...
Just moments later, they arrive at the patient's home. Carol is suffering from severe chest pain.
Yeah, they're here now, yeah.
Hello, darling.
Hello.
Whereabouts are we going?
Just in the front room.
Just in the front room.
Thank you.
Hello, sweetheart. What's happened today, darling? You got pains in your chest? OK. How long have you had those for?
Yes.
All right. Whereabouts is your pain, darling?
The thing's not working.
Right there. OK, darling. All right. Have you had pain like this before? Yeah. OK. And what was it before? Did they give you a diagnosis? Just angina.
Angina is caused by a lack of blood to the heart muscle. Its main symptom is acute chest pain.
With Carol, she was in quite a lot of pain. She was struggling to talk to us, and she was quite clammy and quite sweaty. There is a good chance that she was developing what's called unstable angina, which is the cramping of the heart without any exertion. She could then have a heart attack.
Carol's been using a special medical spray, which helps to widen the blood vessels to ease the symptoms during an attack.
Okay, what type of pain is it, darling? A bad pain, a sharp pain, a dull ache, a pulling, a sharp. Okay. Did the spray help when you took it? A bit. A bit. If you had to score your pain out of 10, where would you put your pain? About an 8.
I'm going to try and sugarcoat it.
Carol's clearly in a huge amount of pain, which Tina wants to get under control. But before she does that, she needs to reduce the risk of any blood clots forming, which could cause a stroke or heart attack. She wants Carol to take an aspirin.
Sweetheart, I'm going to give you this, OK, just in case it's your heart. OK? Yeah. There we go. I'll let you have a swig of water after you've got to get all of those bits out. Wonderful. We can give you another shot of your spray if that's all right. Is that OK? See if we can sort this pain out for you. Just a spray. You ready? There we go. Sweet, how's that pain now? If you had to give it a score out of 10 now. I think we're going to have to pop you at the hospital, aren't we?
Carol might still be at risk of a heart attack or a stroke. To rule that out, Tina and Donna need to get her to the hospital urgently for a blood test.
Just a couple of bumps, my darling. There we go, and I'll get you lying down. There we go. OK. You've landed, sweetheart.
There you go. Some lights on.
Lights on. All right, sweetheart. How's that pain now? Is it still a 6? Has it got better? Has it got worse? Still about a 6. OK.
The level of pain Carol is still feeling is a worry for Tina.
Would you like some stronger painkillers? It means putting a needle in your arm
There are side effects to it, but we can try and counteract some of the side effects. So it's up to you, darling. Do you want something stronger? Yeah? OK.
While daughter Claire joins her mum, Tina prepares the strongest drug they carry.
I'll start doing the morphine.
Your morphine and blood pressure normally
Plummets. Yeah. I'm glad that you've told me, because we'll give it slightly slower. Yeah. OK? Sweetheart, this can just make you feel a bit woozy. Sweetheart, what would you give that number for your pain, or what number would you give the pain now? Still, so it's going back up. OK, sweet.
With the pain worsening, the morphine can't come soon enough.
OK, so here's the pain relief. All right. OK, hopefully that'll just help ease it off.
Even with the morphine, Carol is still suffering.
How are you feeling? What's your magic number now? You're going to get sick of me saying this, aren't you?
I get no better, sorry.
Carol was in quite severe pain, so we wanted to get her pain managed before we went to the hospital. It allows the doctors to assess her better and bring about a better treatment plan for her if we can manage that pain before we arrive. All right, let's give you another little bit. Like I say, it's better to be safe than sorry. Because if I'd given you it all in one go, knowing my luck, you'd have blacked out on me, and that would have just complicated life. OK. All right then, darling, we're here. OK? What's your magic number now?
It's 4 now.
Better 4. OK.
Finally, the pain seems to be coming under control.
Right, darling, your blood pressure's still OK. Do you want a bit more?
Please.
Yeah, that's OK. We don't hold you to ransom over it. It's not ours. OK? There we go. OK, a couple of bumps just as we go down, my darling, all right? OK.
Carol will be taken off and checked over in hospital by the cardiac specialists.
OK, if you want to follow us. Although her heart trace was perfectly normal, because she's got a cardiac history, she's got angina, which would say it's a heart. We have to assume the worst, and then at least, if it isn't a heart, it doesn't matter, because we've treated for the worst. So if it was, we've covered all bases. It was a good job, actually.
Careful, Pre, because I'm not sure there's one of these ones down here which we won't fit under. 2 seconds. Have a look up here. Is there the height on here?
No. Oh, yeah, hang on, move. Height 9.5. Yeah, we're good.
Yeah, cool.
We're good.
Just I know there's one bridge around here which we won't get under. That'd look amazing, wouldn't it, if we got stuck underneath a bridge?
It's 7:30 a.m.
Let's have a nice snooze. I thought you might have gone for a snooze. I was about to come and join you.
Paramedic Grant Porter and student paramedic Lewis Prosser are just an hour into a 12-hour shift.
But I know if I snooze after not sleeping, I won't want to get up.
No, you're going to wake up and start you.
When they get their first emergency call. A lady has dialed 999 because her elderly husband needs medical help.
Prone to falls, there's fluid on the heart, wait for an attendant. Fallen still on the floor, injured his arm, is bleeding. So he's had a tumble.
The crew are at the scene in just 3.5 minutes.
Hello, ambulance service.
He's upstairs.
He's upstairs, is he? Right, you.
The bed.
Oh, just on the side, is he?
Thank you.
You're making a tease, you.
There we go, up.
The crew find 94-year-old Walter on the floor next to his bed, looking bewildered.
Good morning, sir. What are you doing down there? You all right?
Man's fall under the blanket.
What's happened then, Walter?
Slumped off the bed.
Oh, you've grazed your arm there as well?
Yeah.
Oh,
Well,
dear.
is it his head? Well, not. He cut his arm.
Hey, we can.
Knock the lamp off.
You can put a little dressing on that for him.
I'll call the lamp. Give me the headache.
Giving you a headache? Did you bang your head?
Just on the back.
Just on the back, is it? Right, well, I can't see any bleeding. Feeling dizzy at all?
No.
Feeling sick?
No.
I think that's the main thing about elderly fallers. They're just so, utterly bewildered. How could this have happened to me? How could I have lost my footing? They can be upset. They can be frightened. And it's up to us, really. It's just sort of calm everything down. Look, you've had a fall. That's what we're here for. We're here to make everything better. So just relax. We'll do all the work for you. We'll do most of the work for you. What's that? Oh, you got a little bit of a bruise on your hand, have you?
Yeah.
Is that from today? From you falling out of bed?
Yeah.
OK.
He bruises very easily.
It's like a peach, is he? Your feet normally they're swollen, Walter?
Yeah.
Yeah, OK. Got any problems with your heart?
Yes, it's irregular, like.
And do you find it difficult to stand up?
Oh, I have difficulty getting.
OK. When was your last fall, Walter?
I don't know, you'd have to ask the wife.
Ask the boss, is it?
Walter and his wife have been together almost 70 years. But aged 94, he's not as steady as he once was.
Okay. You can have this back shortly, Walter. We're just going to have to get you up. Okay.
Bring that a little bit closer. I think that will do.
You ready?
Yeah.
On three. 1, 2, 3. Push with your legs. Push with your legs. Oh, good man. Push, Walter. You've got
Yes, well done, Walter.
Well done.
Right, hand on the
Man,
frame.
suit yourself.
I'll go me back.
That's all right, I got your back.
Put his frame a bit further forwards because he's leaning backwards on it. There you go. He's up.
You're stopping him now.
Should we ever sit on the bed, Walter?
Yeah.
Come on, then.
With Walter clearly unsteady on his feet, the crew want to make sure he's safe before they do further checks.
Ah, good man. That's better. You managed to get up on your own after all. You didn't know your own strength. It looks worse than it is. It literally is just the top layer of skin.
Well, the skin's thin now.
Yeah.
This one under there seems to be sore.
Lift your arm up in the air. Right, bend at the elbow.
That's it.
You're getting a bit of a bruise coming. Yeah.
Walter's managed to bruise both his elbows and has a nasty cut on his arm.
It's on there for you.
So Grant needs to get him bandaged up.
Walter, that's all done now. That's all done. It's all dressed. You can let go of your sleeve now. Yeah, you're all done.
Well, as you get older, your skin tends to lose its elasticity, so you're more prone to cuts. In Walter's case, he had a good wife to look after him. You were fairly confident that he was going to be sorted with that. The skin tear wasn't the issue, it's the bump to the head that we were really on the lookout for.
Right, let's have a better look at your neck and your head again. There's not even a bump. Nothing there. Can you turn and look at my colleague? Can you turn and look at me? Can you look at the ceiling? Can you look at the floor?
With his neck because he tends to drop his head a lot.
Right. No pain there. No, all normal. Okay.
All normal.
Can I shine a light in your eye, Walter?
Yeah.
Your eyes. You look straight at me. That's lovely. Do you do the shopping for Walter?
Well, my son comes down there. I can't do it shopping.
Comes in and
Yeah. I take it he's earned a bit of retirement at 94.
He's 94 and I'm winning 90, so I mean, we've been retired a few
65 when I
years.
retired.
65?
From work, yeah. And I walked out. I said, that's me finished.
So far this morning, all we can find that's a bit of a miss is you took a tiny bit of skin off your elbow, which is jolly good. So everything else is tickety-boo. You need to speak to your doctor because you're going to need that redressing, okay? Because that's just a temporary dressing. It's not. We're not masters of dressing. You need proper nurses who really.
Speak for yourself.
Okay. What I'm going to ask is, I know you have stood up for us, but I just want to see you walk about a bit.
With Walter all bandaged up, the crew want to make sure he's steady on his feet before they leave.
Are you okay standing like that?
Yeah.
You sure?
Yeah. There's no stopping him now.
And seeing him move so swiftly reassures them he's not done any serious damage.
He doesn't plod, does he?
I know you say he walks with a frame. He didn't tell me he runs with a frame as well.
It's been a pleasure meeting you, my sweet. We'll leave you in peace.
69 years together.
1952, they got married. What else come about in 1952?
They definitely didn't have Wi-Fi. And for a lot of people, that's the be-all and end-all. So if you say it was before Wi-Fi, it's like it's before rocks.
BI, before internet.
Yeah.
Bless him, 94, he was running with that frame.
It could
Never
stop
seen
him.
a 94 year old move quick.
Do you want to take it nice and slow to the vroom? Off he went. Should we come downstairs now, Walter? I half expecting pole vault over the side.
At hospital, Louise was given strong pain relief and discharged the same day, once her back pain had calmed down. Her degenerative spine disorder will not improve without surgery. She's currently waiting to see a spinal surgeon. Paramedic Preet, who was thrown to the floor when a car pulled out in front of the ambulance, also had to stay in A&E. It turned out she'd broken a rib and had to take time off work to recover. Alfie was taken to hospital and spent the night on the children's ward. They believe his fit was caused by conjunctivitis and tonsillitis. He was given a course of antibiotics and is now much better and back to being his usual cheeky self. After injecting himself with buprenorphine, a drug used to treat heroin addiction, Ashley was taken to hospital. He didn't have a blood clot, but was diagnosed with emphysema, a buildup of pus in the lungs. Ashley needed his chest drained and was kept in hospital for 6 weeks to recover.
999 mode activated.
After going for a scan, doctors diagnosed Carol with a blood clot on her right lung. She was kept in hospital and monitored for 3 nights. She's now on medication and should make a full recovery. And Walter got better quickly. He's still a little unsteady on his feet, but has had no further falls. His bruised arm has also healed nicely.
Back to station we go.
Let's go. Take me home, country road.